Your Royal Highness, Crown Princess Mary, Ambassador, and distinguished guests. As Fred Olsen just said, this is the first time ever in history that so many experts are gathered in one place to discuss best practice in skin cancer prevention. And we have had some really exciting days. We are on a big cloud right now, all of us. And we have shared knowledge and experience, and we have been really inspired by each other. And now we would really like to pass on to you some of the most important messages that have come out of all the presentations and workshops, and also all the informal discussions going on. And this is a difficult task because there's been a lot of work done in some very intensive days, and we have a few minutes to leave it over to you. So I would like to invite on the stage 3 of the leading international experts in the field. So please. First of all, Craig Sinclair. He is Director of the Cancer Prevention Centre in the state of Victoria, Australia. And also he is the advisor on UV exposure and sun protection for the World Health Organization. And Professor Brian Diffie. He has carried out extensive research into the effects of UV exposure on the skin, as well as the environmental and behavioral aspects of exposure to the sun. And finally, Bruce Armstrong, professor and renowned international expert who has carried out research in the causes of melanoma and skin cancer. Among his very many titles, Professor Armstrong has been the Vice Director of the Independent Research Institute, the International Agency for Research on Cancer. So, let me start with you, Craig. This is the first time ever that we have brought together so many experts in the field. What do you think that we can get out of that?
Well, this has been an absolute sort of unique opportunity, and one of the very rare occasions we can get people in the same room who have all the same passion and interest in the area of skin cancer prevention. That's made that a tremendously rich, unique and exciting process, because this is not something that has happened really on this sort of scale before. And it's been obviously a great opportunity to network, to learn, and more importantly, with a lot of enthusiasm, go back home and apply. So it's been a really tremendous event from that point of view.
But wouldn't you think that we are very different? We have different cultures, we have different sun exposure. What can we learn from each other?
Well, there is a key learning from all of this. And the one thing is that we've all learned in all our experiences from different countries is if we apply a very comprehensive approach to skin cancer control. So it's multifaceted, it is involving media, it is working with schools, it is working with workplaces. We can change behaviour, we can influence behaviour and attitudes. And this is really important. The other thing which is critical in this though, is that if we put our foot off the pedal, if we reduce our investments, if we slow down our efforts, we know that the population will very quickly regress in their behaviour. And we will see, as a result of that, increases in sunburn, we will see increases in desire for a tan, less people wearing sun protective clothing, which will only have an impact on skin cancer rates further down the track.
Okay. What about you, Brian Diffie? You are an international expert and now you have arrived to Denmark. What are the greatest challenges that you think we are facing in this field?
Well, for those of us living in countries like Denmark and the UK, where I come from, we just love being out in the sun. We're not a country known for lots of sunshine, so when we get the opportunity, we just love to be out of doors. And I think this is particularly so at this time of the year. We're just coming into our winter, to our summer months, but with a pale skin that hasn't seen the sun for many months. And as soon as the sun shines, we're just going to be out there. I think the message that I would give is that what we need to do is certainly to enjoy the sun, but to take real care during our recreational exposure at the weekends, during the summer, but really not worry too much about our casual exposure. And secondly, we really shouldn't be too concerned about vitamin D and sun exposure. Most of us make more than enough vitamin D during the summer months just going about our normal duties. And really there's little that we can do in the summer that's going to influence our winter levels of vitamin D. And so I think the message is you don't need to overexpose your sun or to be too hung up about how much sun exposure you're getting. Just go about enjoying life as you would normally, take sensible precautions, and that'll be fine.
I hope that the press corps heard that very clearly. clearly did, you guys. Okay, so whom do you think we should address with those messages? Diffie?
Oh, sorry. There are a number of... First of all, we all need to take individual responsibility for our skin health. I mean, it's down to us what we want to do and how we want to behave. But others can help us. Policy makers, for example, can ensure that shade is provided in areas where large numbers of people gather for their recreation. Health professionals and educators can advise us on the best ways of behaving safely in the sun and protecting our skin. And lastly, I think that parents have a particular role to play in instilling in their children from an early age the dangers of overexposure to the sun. This is not to keep your children indoors and prevent them from enjoying the sunshine, but just to make them aware that the sun really is a benevolent enemy. It's there to be enjoyed, but it has a dark side as well. So those, I think, are the people who can help us enjoy the sun.
Thank you very much. What about you, Bruce Armstrong? You have been part of very many political systems. So what advice would you give to the politicians and authorities here in Denmark?
I think the most important thing is to give this issue priority. We have a priority on smoking, alcohol, now exercise, obesity. But skin cancer is very important. In every developed society, as incomes increase, melanoma rates go up, other skin cancer rates go up, because people have greater opportunity for recreational exposure to the sun. And there comes a time when the government must give priority to skin cancer control. Secondly, I would emphasise very strongly one of the messages that Craig gave, and that is social marketing is a very important program to bring to the community the importance of the issue and the importance of sun protection. This is something that ultimately only governments can afford to do, and to do well, and it needs to be done well, and it needs to be done persistently, not just now and then. Thirdly, I would bring this very important message about sunbeds and solariums. This is relatively new information. We now have the evidence from the experience of mainly young people who took up solarium use and have now suffered melanoma in consequence. In Australia, in people under 30 years of age, 16% of melanomas are caused by sunbed use. Now, we have a much lower use of sunbeds than you have here in Denmark. We have a much higher amount of sun exposure.
Yeah.
So you can imagine that that proportion is much greater here. And so governments have to take this message on, and there are several very important things they must do. Firstly is to protect the young. Young people are not able to balance up their future needs with their present desires. One way of helping them in respect of sunbeds is basically saying no. Under 18, children may not go to solariums and sunbeds. Secondly, those solariums, for people older than that who may want to use them, need to give them full information about the harm so that nobody goes in there without an understanding of what the consequences may be, and they must absolutely ensure that the equipment that is used at a safe level. The European Union has recommendations in that respect. They've not been taken up uniformly around Europe. They should be, and Denmark should certainly be a leader in that respect.
That was a clear message to our politicians, right? The three most important messages, just in short, from the conference for the global population, would you say?
Well, I think that we have realised that perhaps the issues around benefits of vitamin D, particularly in preventing cancer, preventing heart disease and so on, may really not be as well established as they might be. And so the notion that, well, we should go out and get much more sun because we will live longer, even though we might get skin cancer, is probably not a really good message. And so I think people need to take very much to heart what Professor Diffie has said, and those small amounts of sun exposure just during the normal activities will be quite sufficient. We don't have to go out and get more. Secondly, recreational sun exposure. This is what's the principal factor, particularly for melanoma, but also contributing to other skin cancers, and that's when protection is necessary. And that protection must include shade when it's available and when it's not getting in the way of what you really want to do. Clothing, same things. Wear clothing unless you really need to take them off to go into the sea. And when you've got bare skin, sunscreen used properly.
That was like we're saying it, so that was very nice to find out.
And I think the last one, of course, is whatever the government does, don't you go to solariums. You make the decision. You don't need it. It's not necessary.
Thank you. I'll just finish with you, Craig, because I think you are the person in the world who's most in touch of what is going on in skin cancer prevention in all our countries. So what has surprised you the most through these days?
Well, it's really, what I've really loved and experienced in this conference has been the passion, the enthusiasm and dedication of the participants who've really embraced this issue of skin cancer prevention and are so charged up to want to go home and do something about it. The second thing is really the importance of skin cancer. It is a serious public health issue, not just in Australia, where I come from, but right here in Denmark. And we know that skin cancer prevention works. And not only does it have the potential to reduce melanoma rates and deaths in places like Denmark, but it has there's substantial evidence that it can reduce treatment costs to governments. So it's an absolutely win-win situation for individuals and for governments to be supporting skin cancer prevention.
Many thanks to all three of you for helping out to summarize these very intensive days in such a short time. You did really well, thank you. And we hope that this has given you a little taste of the exciting days and outcomes that we have had together.